Good evening, I'm Patrick Moore.
I'm Marlisa McLaughlin.
Welcome to Health Buzz.
Perspectives on natural health.
Well, we have a very exciting show this evening that we've been waiting for a long time to bring you, and it has to do with Lyme disease. I think everybody in our area, southeastern Connecticut, is very familiar with Lyme disease, which was first diagnosed in 1975 and named after old Lyme. Well, there are many people today who consider it a pandemic because over 300,000 Americans are being affected with it today. So what we're going to try to do today is tell you what is Lyme disease, what are the symptoms, how they can help you, how it's diagnosed, what is the conventional treatment, and we have a great guest, Dr. Adam Breiner, who will be going over a lot of the alternative medicine and naturopathic therapies for Lyme disease. So Marlisa, could you do the honors?
I would love to. Dr. Adam Breiner is Medical Director of the NeuroEdge Brain Performance Center, a division of WholeBody Medicine LLC in Fairfield, Connecticut. The center is one of the only freestanding hyperbaric oxygen therapy facilities in the region, focusing on helping patients with neurological conditions. He's a graduate of the Canadian College of Naturopathic Medicine and a featured speaker on numerous natural health topics, including neurological disorders and Lyme disease. Welcome, Adam.
Thank you.
Welcome, Adam. Nice to see you again.
Great to see you.
I just wanted everybody to know that I've known Dr. Breiner for 12 years. 12 years now?
14 years.
14 years.
14
I think it was 2004.
Something like that.
2004
Oh, okay.
when I brought my mother in to see him. My mother had a traumatic brain injury, and all the neurologists and doctors said she'll never walk again and she won't be able to function more and she's going to be in total nursing care. Brought her to Dr. Breiner, and through his innovative therapies, and I mean innovative therapies, within weeks she was walking and defied all of the medical establishments. So I take my hat off to him, and we're delighted to have you, Dr. Breiner.
Thank you.
So tell us, I mean, your practice is whole body medicine in Fairfield. What is whole body medicine?
Well, we look, like it says, at the whole body. Okay, as people come in, they say, I have this disease and that disease, and everyone always sees an ologist. Yeah. We're looking at everything. We are a center that incorporates also a whole body dentistry with my father. We have other naturopathic physicians like myself at the center, and like you said, we have very innovative ways and methods to help bring whole body health. Wow. Always looking for the new stuff.
Well, today our subject is going to be on Lyme disease, and let's start right off and use our time well. You have dealt a lot clinically with Lyme disease.
Yes.
What exactly is it?
Well, Lyme disease, as you mentioned, is named after Old Lyme, Connecticut, and it is a disease caused by a microbe called Borrelia burgdorferi, which is a spirochete. Looks kind of like a corkscrew. And if you could look at one of the slides that we have in here, this is carried by typically ticks, deer ticks, called Ixocytes scapularis, and field mice, deer carry it, but many other animals carry this disease, or this microorganism. And around here in Connecticut, about 90% or more are infected with this bacteria.
Of the
Borrelia burgdorferi bacteria.
So
That's
Adam,
a pretty, yeah.
Oh, I'm sorry, I was just wondering, so who gets Lyme disease?
Who gets Lyme disease?
Yeah.
Pretty much anyone can get Lyme disease. Okay, it cuts across all, from young to old, rich, poor. It doesn't make a difference. Almost anyone can get it, and you can get bitten by a tick, and a lot of times you don't even know you're bitten.
And animals can also get
Animals
Lyme
can
disease?
get it. A lot of pets get it. A lot of veterinarians know about Lyme disease because they often treat dogs, cats, horses often get Lyme disease.
So often people don't even know they have it, or they've been bitten, because the ticks are so tiny. You can
Depending on the time of year, the ticks can be nymph stage, can be so tiny.
Yeah, the baby stage.
You wouldn't even know what if they even
And
looked
I
at.
understand they secrete some type of acid of some kind, that so you don't have itching or something like that.
Yeah, a lot of people wouldn't even know they're bitten, but afterwards you may develop a rash called the erythema migrans. Sometimes it looks like a bullseye.
Yeah.
And they go, oh wow, what's that? But sometimes you don't even know if it doesn't look like bullseye. It could just look like a little tiny bite, or it might look like a bruise. And that's only about 30% of the cases. Most times people wouldn't even know they were bitten, and then they can start developing symptoms.
Yeah, I think in people's minds a lot of times they might say, yeah, I didn't get that ring, So I probably don't have Lyme, but it's, as you're saying, it's only about half of the time or even less,
Probably even less, about 30, I would say probably 30%.
30%.
And people may become symptomatic at that point with symptoms of either joint
that's common.
joint problems, or even just feel like you have like a flu-like
a
symptoms,
fatigue,
a little mild
just not feeling
fever,
yourself, malaise. Like a
then the malaise or
malaise.
or their sore throat, or you just figure you might be sick with just something.
Yeah.
Those are sometimes the initial symptoms that come up, and it could be right then or it could be weeks or a month or so later. And a lot of times those are the initial symptoms that people might notice.
I'm wondering if the symptoms come on very hard all at once, or did they go up and down, or is it different per individual?
I think everybody's individual.
Individual.
Yeah, everybody's an individual when it comes to that.
So you've referred to it as the imposter also with symptoms. Could
Yes,
you?
Lyme disease is the great imposter. I think, do we have another slide on that? Let's just see if there was anything there with the slides. Okay, that's a little bit about the
That's
detection.
the first test they do.
That's one of our first tests. I'll go back to that in a minute. So, but basically, the symptoms, it could be pretty much anything you can imagine. Everything from neurological, depression, anxiety, symptoms of the heart, okay, arrhythmias, okay, you might think of like your heart is just skipping beats or something.
Brain fog.
Brain
a lot of
fog
people-
is
Brain fog, right?
Big,
yeah.
big thing for Lyme. Gastrointestinal symptoms, facial palsy. People heard of Bell's palsy,
And
right?
also animals. You showed
Animals
us
can
a
have
cat
can
had ball, yeah.
exactly. Animals, cats can even have that. Dogs, whatever. So it ranges. I call it the great imposter because it can look like almost any
Yeah,
disease.
it can mimic almost any disease out there. So what do we
Exactly.
do about it? What's the first step?
First step is always to go to your physician. Okay. Unfortunately, a lot of them aren't as versed into how to test because a lot of tests are not as good at detecting Lyme. It's a very hard thing to detect when it comes to lab tests.
Why is that?
Because the immune system has to detect it. It has to express antibodies and has to fight it. And Lyme is really good. I showed you at the beginning that picture. It looks like a little corkscrew.
Yeah.
So what can a corkscrew do? It can
Go in and
it can
hide.
burrow into tissues and it'll
Yeah.
try and hide out and evade the immune system. It's really, really good at doing that. So the first test that they will run, if they suspect it, would be something called an ELISA test, and if that comes back positive or negative. If it comes back positive, they'll run something called a Western blot. And if we go to the previous slide, the slide I just showed before, those lines, that's a Western blot. So everyone talks about, oh, I have a positive band, I only had 2 bands, or I had no bands positive, or I had 3 bands positive. What does it mean? Now, what happens is they take the person's blood, they spin it down, they get the antibodies to certain specific parts of the bacteria cell wall, okay? So look at the very far right line, that's like line number 8, okay? That would be a control. And you see it has 94, 68, 60, 41, 39, okay? That means is the weight of the actual antibody. They're called kilodaltons. So you have a charge, you have a plate which you put some of the blood sample in, and it moves, right? Heavier things will travel farther, like gravity, and lighter ones will travel less. That's what the band literally means. So if you're 94 kilodaltons, you weigh a lot more. And then if you look on the slide over as well, you see that number 2. Now notice how you see those lines there. You see that 40, let's say, well, number 2 there, you see how the line is a little bit dark, and that corresponds to band number 41. Look at number 33, that also correlates to that band. But if you go over just a few wells, you see how it's very light, and you can't quite tell, is it positive or is it negative? So a lot of times it's scored incorrectly, and a person may actually be showing positive immune markers when they were really, and it's coming negative on the test. So we can go off
The
of that
bottom line
slide.
is most patients never see any of these type of things.
They don't
It's
see it.
basically
They
a
just see a
doctor or
report.
lab that has to interpret them. And
Exactly.
what you're saying that it could be really a question mark sometimes as to whether
could be a
is
question
or
mark.
isn't. And so it's a dilemma. You
It's
could
a
walk
dile-
out of there with a false negative, a false positive, or
Often people have a lot of false negatives in this test, not very many false positives.
Yeah.
So that means it's missed a lot, and doctors unfortunately are relying too heavily on the test and not on the symptoms of the patient.
So also, sometimes people are thrown at antibiotics before they even get the testing?
Sometimes, and even according to the CDC, if you have the symptoms and it smells like it, you should treat. Now, they talk about 14 to 21 days of antibiotics, like something like doxycycline. And once you get treated according to the conventional medical model out there, that's it, you're cured. Okay, you've had your 2 or 3 weeks antibiotics, but what happens if you're still not feeling good?
And your immune system gets compromised by the onset of the...
But you would have to say with conventional treatment, if you do get it on the onset, catch it quickly, usually that 2 to 3 weeks of doxycycline antibiotics are effective most of the time.
Maybe.
Would you say?
Maybe.
Maybe.
We don't know. We don't know. There's a lot of controversy surrounding this disease. There are people who, and I think there are some people, and I think it depends on their immune system, how strong constitutionally they are when they get that bite, if they get the treatment, whether antibiotics or not, or more alternative treatments right away, or in combination with the antibiotics, you may have a fighting chance of it being wiped out. However, there are a lot of people who have remaining symptoms that can go on for years and become quite severe.
So what you're suggesting is also the inner terrain of the person when they are exposed.
Absolutely.
If they have a strong immune system, they're doing all the good things you recommend to your patients.
Absolutely.
They have a greater chance of not being affected by it so much.
The more you can do about keeping your body healthy, the better off you'll be. The terrain is the game. These bugs are going to take advantage of a body that is weak. Okay? Very, very important to
Well,
keep
that's
that
what
in
Louis
mind.
Pasteur said on his deathbed when he had to admit it wasn't the pathogen, it's the inner terrain that is really crucial, right?
It's the inner terrain. It's the
Yeah.
inner terrain. I mean, the people. I think when we spoke one time on the phone, we said, why do people, the elderly people, like to go to Florida for the winter? Because it's so much more hospitable for them.
Yeah.
So the same thing. If your body is filled with toxins and nutritional deficiencies and things like that, I think we looked at these obstacles to cure. We say, well, what would be an obstacle from getting somebody better? They don't have the right nutrients. They're not having the right diet. Their bowels are dysbiotic and they're leaky gut syndrome. It's a whole other topic. I mean, each one of these points can be an entire show upon itself. You may have other infections. We talked about dental foci. Like, let's say people have a root canal or something. May not be a problem, but once they get Lyme disease, it could be. Negative emotions, right? You're going through a lot of trauma emotionally in your life. I've seen that when people all of a sudden they have something emotional, and the Lyme was dormant. It never came out. They didn't have symptoms, and boom,
So they
become
the basic,
sick.
what we take away message here is that so many people are just kind of not taking care of themselves, and then they get exposed to something, and boom, they go down quickly. But optimal nutrition, prophylactic nutrition, diet, emotional wellness, and all these other things that you practice in whole body medicine.
Yes.
Right?
These are the type of things you could do to help,
Yeah.
like even preventatively.
Prevent.
But in order to treat someone with Lyme disease, we have to go after all those obstacles
Yeah.
in order to get them well.
So you need to remove the obstacles,
You need to remove the obstacles to
like
cure.
reconstructing your house. So you have to just tear it down,
Exa-
get everything out.
Your house is-
Exactly. I tell people, I say, it's like they love hiding out. The toxins are their shelters. The toxins are their home. So you got to kick them out. You got to rip down the house, and then you can kick them out.
No.
And hope they don't come
And
back.
hopefully they'll come back. So you got to make it as inhospitable to them, but as hospitable to you as possible.
Okay. So
So once you identify these obstacles, what's the best way, most effective way to remove the obstacles?
Well, I mean, we can look at various techniques. I think we have a slide here. Again, looking at the nutrition, using different supplements, nutritional supplements. Homeopathic medicine is really great helping heal with Lyme. It's a very gentle stimulatory effect on the body to actually wake up and recognize the infection. Different herbal medicines. There's some great natural antibiotics that God created that these guys can't really build up defenses against like they can some of the pharmaceutical antibiotics. Again, detoxifying the body and eliminating other infections of the body. In hyperbaric oxygen, one of my specialties is all about using oxygen because these bugs don't like a lot of oxygen.
now they're anaerobic, which means they thrive in a low oxygen environment. And the principle behind hyperbaric oxygen therapy is high pressurized.
High pressure oxygen. So if we look at, this is a picture of myself at one of our hyperbaric chambers, and you're literally sitting in a chamber filling with 100% oxygen and compressing it so all the oxygen gets just super saturated in every cell, your brain, everything. This is something we did with your mom, Patrick.
Yeah.
Yeah.
And I just have to say, it's actually, some people may get claustrophobic, but I know most people are very comfortable.
Yeah.
It looks like you're being wrapped up into a little
It's
coffin.
look, you could see. Look, you could have just seen that. The patient could see out. They could watch TV. It's very relaxing. Some people just go to sleep and
Yeah, I think my mom,
you
I don't know
feel
how
well?
many treatments she had, 40, 50, I just
Singing
60,
in the Rain.
and she was watching Singing in the
Oh,
Rain
that's right.
Gene Kelly
every day, Singing in the Rain. She must have watched it 50 times, and she never got tired of it.
never got.
Yeah, so it actually was a very great experience for her. And so the hyperbaric oxygen therapy is really effective. Are there, could you name maybe 3, 4, 5 herbs, the most antibiotic herbs you can think of, or 2 or 3? We know garlic, right? Would that be one?
Garlic, yes, garlic can be helpful. Things like Cemento Undacaria, cat's claw. So it's known as. Cat's claw is a big one.
I thought you were talking about cement.
Cement, no,
Put cement down your body.
not cement.
That'll
Oil of
kill
oregano
everything.
can be helpful, but there are a lot of other ones. I put up this slide talking about the terrain is so important. We got to reduce inflammation in the body. Really, really important. Alkalize the body and help the mitochondria by increasing cellular oxygen. So some of that
Just to
would
stop
be
you
with
there, not everyone knows what could you explain
Alkaline?
alkalize the body?
Yeah, that's a good question.
Well,
a little.
all right. Our bodies should have a very specific pH, which is like 7.46. So you've probably heard of like lemon is acidic, right?
Yes.
You have like certain
Apple
things
cider vinegar.
apple cider vinegar, things like that. But our body is a very, very narrow pH range. So if you're slightly too acidic, things just don't work well. If you're too alkaline, things don't work well. So generally people tend to be too acidic. So how do you alkalize? A lot of fresh vegetables and fruits, a lot of greens, things like that are some of the basics of
Lemon
alkalinity.
juice.
Taking
Some
sometimes
lemon
lemon
juice.
juice in your
Yeah.
body, which you think is the opposite because lemon is acidic, but actually it
Yes.
helps your body become a little bit more
What
alkaline.
it has a bicarbonate reaction of some kind, and it
Yeah,
converts.
there's some complex biochemistry
Yeah,
there.
well, I
but-
thought you were the biochemist.
No, I'm not the biochemist. I just the people chemist.
So, okay, we got a couple of herbs. So you're looking at inflammation, the body. You want to quell inflammation in the body.
Well, inflammation. Things like curcumin is a really good
Curcumin,
herb.
turmeric, as
Turmeric.
people know it as turmeric, and ginger, I would think, and all in the same family, curries.
And
What about-
look at vitamin C is a great anti-inflammatory. Glutathione. I mean, all these things are great with.
Hey, Adam, don't use those big words.
Yeah, how
around us.
can you, what does
Glutathione,
glutathione
no,
mean?
glutathione.
No,
How
I
can
can't-
we get it?
Glutathione is the most, well, we don't have time.
it's
That's
the
a whole show.
antioxidants. Antioxidants.
Most
Okay.
important word in
There you
medicine
go.
to me in
There you
terms of
go.
health. How do you raise the antioxidant system in your body?
Mm-hmm,
What about my favorite? We did a show on this, coconut oil.
Coconut oil is
Because it's antibiotic, antifungal.
it's got some antifungal properties, and a lot of people have been at antibiotics for a long time, end up having systemic fungus infections, systemic candidas. So things
yeah.
like coconut oils are great. Plus, is a short chain
Medium
fatty
chain.
acid.
Yeah, I was
Sorry,
gonna
medium
ask about
chain
that.
is saturated fat, which feeds your gut. So it actually likes to eat that fuel. It's a fuel, so it helps your gut actually heal up.
So the
it's really-
microbiome is very important
Hugely
here.
important.
Yes, and we also have a show that if you care to look at SEC TV at the YouTube channel, you can look at the microbiome. That might be very helpful right now, as Adam and Patrick further discuss a lot that goes on in the stomach, your gut health.
Yeah, exactly, and I think part of that show, and Adam knows this so well, maybe 70 to 80% of our immune cells, our immunity, is being formed by these beneficial.
Two-thirds of your immune system is just centered right over your gut. So if everything you eat is also being looked at, is it friend or foe? So our body can set up this whole reaction. Leaky gut, leaky brain, and these spirochetes, these bacteria that cause Lyme, the Borrelia burgdorferi, like going through the blood-brain barrier as well. And that's why a lot of, so if you can help shore up that blood-brain barrier, the better off you are.
Yeah, I think that leads to a good point. Not many people, you think of a localized infection with, initially some people think with Lyme, but basically this can go all through your bloodstream, all over your body, is that correct? And it's a bacterium, right? It's a bacterium.
It's a bacteria, it's systemic. I think one thing people have to also understand is, we just talked about this one bacteria, Borrelia burgdorferi, but often these ticks and other insects that might be carrying the Lyme have a whole other host of infections. We call them co-infections. So a lot of times we say Lyme disease, we're saying as a general rubric, and of including things like ehrlichiosis and babesia and Bartonella, and these can all cause a lot of different
We
types
know all
of
those names, don't
disorders.
they?
Yeah, it
Don't we?
sounds like
Oh,
a bar.
Bar.
Yeah, they're all
They're
hanging out.
at the
Well, you
bar.
remember that
At the
picture
tick
that
bar, right?
The
tick
tick
bar. It sounds it's like Star Wars with all the.
That's right,
Think
the
about
cars.
think about that house analogy we showed
Right,
before.
right.
Okay, think of it as like a frat party.
Right.
They're inviting all their friends to hang out. They're inviting them all to hang out, and they all can cause a lot of different health issues.
Now I have a question. When the bacteria is boring its way in the corkscrew, it opens up a space for other infections.
Other things can come through, and that's one part of it. It breaks down some of the blood-brain barrier can be compromised because of that. That's one of the reasons it's an issue. But it can get into deep tissues like away from your immune cells, right? It can go into, let's say, cartilage or something, which doesn't have a lot of blood supply and can kind of hang out, so your immune cells aren't going to get there as easily.
So that could possibly be why there's a lot of joint issues.
Joint issues, exactly.
Because they like to hide, so joints are good
hide
hiding
out,
places.
exactly. Hide out as much as they can. And they also form something called biofilms. It's like, if you're in your teeth when you wake up in
right.
the morning.
Immune system can't see them, right?
Immune system can't see it, exactly.
Wow.
And so when they make these biofilms, they wall themselves off.
Smart. They're like a cancer cell in a way.
Yeah, they're-
Conceptually, where the cancer cells put that protein sheath around them,
Exactly.
cover themselves up, disguise themselves.
These
things are smart.
They're smart, and there's a lot of evidence actually they change their form.
Oh, yeah.
They actually literally
Shapeshifters.
will be it'll shape shift into other forms, these cell wall deficient forms, and so it becomes it's a
Sounds like a
difficult
horror movie,
thing.
right? You should
does.
change,
Yeah.
disguise yourself, come in all different kinds of forms.
Shape-shifting. And then you can't detect, and then you get confused. So it's
And
like
your
a
immune
hall
system's
of mirrors.
confused as well. So
Right.
and that's why some of the blood tests just aren't that great.
And they can change the DNA, can't they? Can they change or readapt, into different?
Well, I think
more
all
resistance
all
to different-
bacteria can
Yeah.
can somehow become more resistant over time, and that's why a lot of Lyme litter doctors who use antibiotic therapies will rotate their antibiotics to try and hit it in different
see.
different stages. We will also, as naturopathic doctors, rotate our natural therapies, even though they have much broader effect, that the bacteria can't get as used to them, but we also rotate those through.
The difference might be, excuse me, that if you're having the rotating antibiotics, you're going to be killing a lot of the good stomach bacteria. So when you're using your natural pathways to that, then you're less likely to have more damage.
Yeah.
Is that?
Exactly. And a question to you on that, because a lot of people get confused. Let's say you're on a long-term antibiotics for 2-3 weeks. Can you take a probiotic, beneficial bacteria, the same day, like
Absolutely.
hours apart? What would you recommend?
I would probably recommend.
Excuse
yeah.
me, some people say, or if it's MD, well, after the antibiotics, then start the probiotics. So
Take them with the antibiotic.
at the same time,
Even at the same time, and take it several times a day, the probiotic.
several times a day.
Because it'll kill off some of those probiotics, but you'll still get some
Some.
of the probiotic through. It's for them to survive. It's imperative that anyone who's taking an antibiotic should take a probiotic no matter what they're treating it for.
Yeah.
And again, some people are on antibiotics not for weeks, but for months or years.
Right.
And
Yeah.
their gut can really
Gone.
be messed up.
Gone.
And
Permanently, it seems. Anytime anyone takes one antibiotic, there's research that shows
Yeah.
one time,
They
one
can-
antibiotic, your microbiome has changed forever.
Forever. Yeah.
Check out that microbiome.
And another thing, when you're talking about that brain fog and things like that, that microbiome also has a major effect on what? Our neurotransmitters in the brain, the serotonin,
Absolutely.
what we're all trying to do to feel good, relaxed. So I've understood that almost just like the immune cells, 70 to 80% of those serotonin cells are being formed. The gut
right there.
seems to be everything, right?
Oh yeah, oh yeah.
Okay.
The brain gut connection.
Yeah.
It's usually important. There's a new journal coming out called Brain Gut.
Axis.
Yeah.
So just to go over this, the food plan and diet should be low, anti-inflammatory food plan with low sugar, low glycemic. You talked about blood sugar
Absolutely.
stabilization type plan.
Yeah.
How about
like
the blood type diet?
blood type dieting can be one way to do it. I think we have a slide here. Low glycemic, which means keep
low
the blood
glycemic.
sugar low. Keep your
Yeah.
blood sugar low. What's the difference in that? like a sugary donut is high glycemic. An apple, low glycemic.
Because of the fiber in it.
Exactly.
It slows down, releases the energy slowly.
Moves the energy slowly, doesn't let your blood sugar spike. Fresh, organic produce. Pesticides are really, really, really bad. They ruin the gut microbiome. They make your body more hospitable for the Lyme disease to thrive and less hospitable for you to live. We talked about biocompatible foods, like you mentioned, blood type dieting, using essential oils, a lot of different things one can use to help
Yeah.
out.
So essential oils, we also have a show you can take a look at too if you go to the YouTube channel on essential oils completely, just some more enhancement.
Which,
for-
by the way, are also, some of them are very effective against that bacteria, that
Could you give us
spirochete.
Like, yeah,
like
like
2 or
what-
3?
I know frankincense.
Oh,
is-
I love
frankincense
frankincense.
is really
Amazing.
good about it.
Frankincense makes sense.
I'd have to pull more off the top of my
imagine
head.
I knew that, right?
Oh my gosh, yeah.
So we got frankincense and myrrh.
Myrrh, probably a lot of the biblical oils
Yeah, a lot of the
are
biblical ones.
actually very good antimicrobials.
So we have
I would have guessed
essential
that.
oils. We have specific nutrients. You've talked about a few things. The low glycemic, the food,
Mm-hmm.
and is there a special, vitamin pill like vitamin D levels, or get your D level up for your immune function? Or
Patrick knows one of our favorite topics is vitamin D, and yet vitamin D cuts across all
Yeah.
types because it's so important for the immune function, brain function, and supplements all across. Magnesium, very important. I think we have a slide here about
Yeah.
that. B vitamins, right? Like B12 for the brain function. Oh, the omega-3, 6, and 9 fatty acids.
for
so
inflammation,
important.
especially to quell inflammation.
Help
so
the
get the fish oil,
Exactly.
flax
They
oil.
help the cell membranes all become fluid so they can communicate better. Vitamin A, vitamin C, everyone hears about that, right? Zinc, so important for the immune system. Q10, we use like liver support herbs, okay? We use special healing mushroom extracts.
So Adam, I think the key
yeah.
here is, for our audience, you can see that this is pretty a comprehensive approach, and you really need to be under the care of someone like yourself who has not only the knowledge of conventional, but the knowledge of all this alternative naturopathic approaches.
Absolutely. Yeah, I think that slide pretty much summed it up. So the more that you can do preventatively to make yourself healthier, the better off you'll be. But if you get sick, you really should see somebody that can look at this whole approach
Yeah.
and figure a way to help your body regain its health by detoxifying your body at the cellular level, putting proper nutrition and going after the microorganisms, and looking for alternative ways to help with that. You also have to think about the emotional component,
That's
right? I told
huge.
you about emotions that can
Yes.
set it all off.
Yes.
So you have to clean that too. So there's a lot. There's
Almost
a lot
like
that
an
has to be.
autoimmune type reaction. in a way,
Autoimmune
right?
diseases. People can have MS and things like that, and they really could be Lyme.
Wow.
So you have to think about
So you
that.
could
And
have
it can come down
diagnosed with Parkinson's or MS, multiple
Parkinson's.
sclerosis, or
You think about any of the
Epstein-Barr.
diagnostic labels,
chronic fatigue syndrome.
all that could be Lyme. It could be Lyme.
Maybe Lyme.
Yeah,
That's-
never just accept a diagnosis. A lot of times people don't have a diagnosis. People have this. Oh, this hurts, that hurts, this going wrong. I'm depressed. I'm anxious. Blah 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 blah. And then what do they usually end up just going on? An antidepressant, because all the doctors can't figure out. They send from one ologist to the other ologist. But in the end, it may have just been the Lyme that set it off,
Wow.
and that's what they're suffering from.
And it can lie dormant for a very long time. You don't know you
Years.
have it, and then later on, and then so you could possibly have a huge emotional reaction, which domino effects taking you down because you don't have the right diagnosis.
I call it Humpty Dumpty syndrome.
Okay.
You could have even been in a car accident, okay? You might have had, again, that low-grade fever or something that was in, like, let's say, 1995, and now you're off in 2016, you get in a car accident, whiplash, now all of a sudden, you're set off, and this cascading of your whole life is coming apart, and really, that organism now has found a home. It's found a place to thrive.
Big
Because of the
fracture.
trauma, you mean it was resident all the time?
It was resonant all the time.
Quiet? It could go quiet?
Exactly.
And a trauma event can sort of express it and
Express
bring
it
it out?
out. Exactly.
Wow.
Exactly.
Well, we really need to
That's scary.
take a good look at that, and we actually are running out of time, so we have to stop
So
here.
what's the
Okay.
message to the audience out there you'd like to leave them behind? I mean, this is kind of a little scary,
It is scary. I think the message is it's a very serious disease. It's almost everywhere across the planet at this point. I mean, there's certain areas more than others. But if you're sick and you don't know why, you got to think Lyme. And don't just think the blood tests are going to be enough alone. Okay? You have to go by the clinical diagnosis, see a doctor, a Lyme literate doctor that can help you get to the bottom of it, and look at all the factors that we discussed today, from nutrition on down, and help bring your body to a better state of health.
So there is hope out there then. There is hope. There are a lot of people out there suffering and they're not sure what it is or what's going on.
That's
or
right.
they've given up and nothing's working. They
There-
should see a Lyme literate doctor like yourself
That's right.
and get a comprehensive approach.
And
There is
become
hope.
your own advocate. You need to self-advocate and really take part in investigating along with, right? Would you?
Absolutely.
that?
Be your own advocate.
Be your
and,
own
if
advocate.
if it's
Go
one
get
of your one of your family members, advocate for them.
Absolutely.
Well, Adam, I'd like to thank you very much on behalf of Marlisa,
Thank you.
myself.
Thank you so
and
much, Adam.
Thank you.
I would like to ask you, I mean, you are also an expert in so many areas, particularly in the traumatic brain injuries out there and things like that. And would you tell the audience you'll come back on again at a future date and
If you want
talk
me on,
about that?
I'll be here. Yeah.
Okay,
Oh,
great.
awesome.
Thank you very much.
Thanks
Thank
for
you.
watching. Have a good evening.
Thank you. Good evening, everyone.